Renal. Different terms that we may hear with the renal system would be polyuria. Poly meaning a lot, so this is increased urine output. Oliguria, when we have an O in front of a root or a suffix, this means decreased. So we would have decreased urine output. Excuse me. Anuria, again, that A meaning absence, so we would have absence of urine output. Dysuria means that we have difficulty with or pain with urination. Incontinence is leaking of urine. We have three different types of incontinence that we're talking about in this course. We have stress incontinence, which is leaking of urine when we have increased intra-abdominal pressure, such as with sneezing or coughing or laughing or lifting something heavy. Functional incontinence happens when we have someone who they're able to hold the urine, but for some reason they can't get to the toilet in time, or they can't get their pants down in time. Maybe they have arthritis, or maybe they have to use a walker. They can't get into the bathroom very easily. There's too much clutter. They have joint difficulties, so they can't move fast enough. For some reason, something is preventing them from being able to urinate as quickly as they need to. Overflow incontinence means they have urine retention, and basically it's overflowing. It's leaking out because there's just so much there. Uh, One other type of incontinence would be urge incontinence, meaning I've got to go, I've got to go, I've got to go. They can't get to the bathroom fast enough. Nocturia, this is awakening at night to urinate. Hematuria is blood in the urine. And pyelonephritis is a kidney infection. Another one I might toss in there would be cystitis. This is a bladder infection. So as we're doing our interview, there are several different questions we can ask. Do they have any hematuria or blood in their urine? How much do they normally void when they urinate? What color is it? And does it have a strong odor to it? Do they have difficulty starting or maintaining the stream of urine? This is especially important in the older male because of prostate enlargement. Do they have pain with urination? And if they do, where's that pain located? Is it in the pelvis, the abdomen, or the flank area? Do they have frequency or urgency or nocturia? In other words, are they having to go a lot? Uh, when they do have to go, do they have to go right now or risk having an accident? Do they have difficulty controlling their urine, such as incontinence? And if so, do they know what causes that incontinence? And what is their history? Do they have a history of UTIs, kidney stones, injury, family history, any comorbidities such as diabetes, heart disease, or hypertension? And what medications are they on? Because some of that can affect the amount of urine, excuse me, and it can also affect the appearance of the urine. So as we're doing our assessment, we need to assess vital signs because that can indicate renal dysfunction. It can indicate fluid volume overload or fluid volume deficit. We're assessing skin turgor. We're assessing their weight because this could indicate fluid retention. We're assessing their mental status. A UTI in the older adult can cause confusion or delirium. This may be the only sign they have of a urinary tract infection. Renal disease in and of itself can cause confusion or disorientation, lethargy, seizures, and coma. We're assessing for pain. We inspect the skin color and integrity. Lesions and discolorations of the skin can indicate renal failure. Edema can indicate fluid retention. And if possible, we inspect the urine. We want to know what color it is, how much they void when they urinate, and is there any odor. And then we palpate. We're palpating the bladder. The bladder should be located just above the pubis symphysis, and it should only be palpated if there is urine in the bladder. So if it's distended, and it should be smooth and firm. We don't want to palpate the bladder if someone has not voided for a period of time. So prior to palpation, we should always ask, have you voided recently? But palpation of the bladder can let us know if there's potentially some retention of urine. And after we've done our assessment, now what do we do? Unless it's medically contraindicated, we would encourage fluid intake, especially water. So we need to hydrate them. But if we have an issue with congestive heart failure, we may need to restrict fluids. Do understand that alcohol and caffeine can act as diuretics. We need to educate on their diet. Cranberry juice really helps with the acidity of the urine. We may need to limit or encourage foods that contain certain minerals or electrolytes if we have fluid volume excess, deficit, or kidney disease. And some of those things that we may have to limit would be like sodium or potassium or phosphorus. We need to educate on perineal hygiene. Excuse me. With women, we need to educate always, always, always wipe front to back only. Keep them clean with soap and water. Different voiding tricks that we may need to initiate. If an older gentleman has an issue with BPH or benign prostatic hyperplasia, they may need to sit to void. Use the Crede method where they actually palpate the bladder as they try to void. Encourage them to take small amounts of fluid frequently and void often. Avoid caffeine or alcohol. Pouring warm water over the perineum, and this can be done with anyone. Running water in the sink or encouraging fluids. Allowing privacy. Some people have very shy bladders and they're unable to urinate if someone is in the room with them. So stepping outside and pulling the door mostly closed. Some women are unable to void unless they're in a sitting position, or some men are unable to void unless they're allowed to stand. Some of the diagnostics we may do would be a urinalysis and a culture of the urine. A pylography, which would provide images of the kidneys and the urinary tract system with the use of a dye. Ultrasound, a cystoscopy where we insert a tube through the meatus to look at the bladder and maybe even the ureters. A lithotripsy, which uses sound waves to break up kidney stones, for example. And those are just some of the diagnostics.